Hello and welcome back to OET Speaking Unlocked by Kirti Institute. Today we are going to discuss on how to utilize your 3 minutes of preparation time effectively. Before we begin, I want to make it clear that I'm using the candidate card used for medicine. However, whatever you are going to learn today applies to all 12 professions. The method is exactly the same, but the clinical context changes. So follow along and apply each step to your role play. Let's begin. When you receive a role play card, you start reading and underlining. But the first thing you should do is step into the scenario. You need to connect yourself with the given situation because it's a role play. It's not simple speaking. It's a kind of a consultation between a healthcare professional and a patient or a carer. Okay, so when the interlocutor gives you the card or displays the card on the screen for computer based test, they verbalize the candidate card number and your profession. It's your role as well to make sure that you have been given the right card, though they don't make mistakes. Then you see the setting. In this case, the setting is local clinic. Now start assuming yourself working in a local clinic as a doctor. Then you read the background information and highlight the keyword while understanding the scenario. You see the parent of a 5-year-old boy. The first statement itself says that you are not going to talk to the patient but the parent. The patient is 5-year-old boy. Now, if the interlocutor is female, consider her as a mother of the child. If the interlocutor is male, imagine that you are going to speak with the father of the child. And who is the child? The child is a son. So when you picturize the scenario in your mind, you don't make errors of he and she. Okay? Let's read further. Who was diagnosed with asthma a couple of days ago? So son was diagnosed with asthma a couple of days ago after attending the emergency department with severe bout of coughing, breathing difficulty, and wheezing. This is a follow-up appointment. The child is not present for the discussion. Now, we can understand that we are about to speak with a parent of the 5-year-old boy who had asthma and a couple of days ago attended emergency department, and all of these symptoms were seen in the child. Okay, so as I said, you connect with the scenario. Just imagine that you are about to speak with a parent who has had bad nights because of child's asthma attack. They are here for the follow-up, waiting for your answers, your responses, expecting reassurances from you. And this is your patient. This is the real emotions of the room. Okay, so this information ideally helps you to understand what kind of language, tone, the voice modifications you are going to use in this role play. Then you read the tasks. Tasks help you to understand how you will begin the conversation and how you will proceed throughout the communication. Okay, so while reading, you will also highlight the keywords and understand what the keywords mean. Okay, don't underline everything because I don't think so that make any sense, right? So you can see here in the tasks all the verbs that helps you to understand what exactly you are going to do. Like confirm, find out, explore, give information, find out, reassure, describe, outline, establish. This helps you to understand what exactly you are going to do in each task. But from my perspective, more relevant is what to confirm, what to find out, what to explore. Yes, and that is exactly what we are going to highlight or underline. So, confirm reason for appointment. So, this point is about reason for appointment, and reason is already given in the bracket. Following asthma diagnosis. Okay, find out how child has been since hospital visit. So, how child has been since visit. Yes, and what kind of response we are expecting from the parent? The parent will inform us about the severity of the asthma, frequency of attacks, and effect of treatment. If we don't get these answers, we'll prompt the parent to speak on it. Yes. The next point is about find out further relevant details. So here we are trying to get more information from the parent, right? Any family history of asthma, eczema, hay fever, any kind of allergic condition. Okay, so this is what we are expecting to get the information from the parent. The next point is about explore possible triggers of child's asthma attack. Here we are going to find out the allergens, right? Exposure to cigarette smoke, dust mites, pollen, exercise, cold air. What were triggering factor for the child that we are about to find out? Give information about childhood asthma. So here your information gathering ends and you will begin providing information on childhood asthma. And you don't need to apply your knowledge. You don't need to have knowledge on childhood asthma. Why? Because bracket information already represents what it is. Isn't it beautiful? You just need to make it into full sentences and deliver in a way it is actually demanded. Okay, so you can see the bracket information says that it's a chronic lung condition, tightening or narrowing of the muscles in airway, swelling, inflammation, production of extra mucus, and also risk factor. Okay, family history of hay fever. So you'll inform about what childhood asthma is and the risk factors. Okay, in this part. Then find out any concerns. So when you are asking if the parent has any concern, there will be concern, and what the concern will be is your next bullet point. Okay, reassure parent about child's asthma. So here we are expecting that the parent will be worried about their child's asthma. Okay, and you are reassuring that it's okay, it is manageable. Okay, it will require regular monitoring, but there are many support systems available. So you are reassuring the parent here. Okay. The next point is describe asthma management. And then you are giving description that how it will be managed. Okay. Identifying and controlling triggers, assessing severity of symptoms, knowing how to respond in urgent situation, informing child's school. So these are the factors of managing asthma. Right, so that is what you will describe to the parent. The next step is about outline next steps. So this point is about next steps. You will just say to the parent that what next you are going to do. Okay, examination of child, creation of asthma action plan, discussion of treatment, organizing support and follow-up appointments. So this is what you will just inform to the parent. Okay, and then you will establish parents' willingness to bring child into room for the examination. So here you are taking verbal consent from the parent for the child's examination. So you can see that we haven't highlighted everything, only the key features. Okay, reason for appointment. So you can instantly create a question. Could you please tell me about your understanding about today's appointment? How has your child been since the last visit at emergency department. Would you please tell me a bit more about your son's asthma? Okay. What do you think is responsible to cause asthma attack to your child? Let me give you information about what childhood asthma is. So you can see that when you highlight the keywords, you can instantly create the response or ask questions. And even if something is not going in sequence, you will be easily able to understand that and catch the conversation from that point. Okay, and that is why highlighting or underlining the keywords is very important. Okay, now, do you think you will start speaking now? No, you should still think about the scenario. You need to think how you are going to open the interview. Okay, how will you introduce yourself? Just close your eyes for a few seconds and imagine that a parent is about to enter your clinic and whose child is sick. He or she will be worried, asking for the answers, asking for reassurances, solutions from you. And this is the reality. And what kind of tone, what kind of soft language you will use. Okay, so in your mind, you can just prepare. Okay, and when the interlocutor tells you to start, you are ready to go, you are confident, you know how to follow the conversation. Yes, and this is a beautiful test. Why? Because the autonomy is in your hand. You can lead the conversation the way you want, right? And that is why I just love this test. Okay. Now, during this preparation time, what kind of questions you can ask to the interlocutor? There are basically three main questions that is generally seen that you may need to ask your interlocutor. Number one is you may ask the name of the parent. Okay. How may I address you during the role play? Okay. Second, if you don't know how to pronounce certain word, you may ask your interlocutor. How is this word pronounced? Will you please help me? Okay. And sometimes it is difficult to explain some terminology in a lay language. Okay. Suppose, especially for, allied sciences like ligament. Okay. Tendon. So you know what ligament is, what tendon is, but how to explain it in a lay term? So if you don't know, you may ask your interlocutor, what does ligament mean? Please help me to understand. Yes, you will not be penalized for that. You may ask for clarification. Okay? But you cannot ask whether I know this patient or this is a new patient. How can I explain childhood asthma? No. That is what examiners will assess for. Okay? So these are the three basic questions that you may ask any of this if you need during your preparation time. Otherwise, prepare like this thoroughly. Be ready. You know how to speak, how to start, how to proceed, how to lead, and how to end the conversation. Right? So, this is all about 3 minutes of preparation time. And in the next video, I'll help you to understand how to open any kind of interview. And I'm pretty sure that after watching the video, you will be confident to at least begin your role play. So stay tuned with me in the next video. I'll meet you to explain you how to begin the role play. See you soon.